So we often hear the question, when should I get retested? So basically you've had testing in the past and you want to know when is it time to revisit new testing. So there's a couple of different things that we tell patients. If you were tested prior to 2010, I would say it's very reasonable to get repeat testing simply because there are certainly new genes, additions to the genes that we already knew about, including BRCA1 and BRCA2. So technology just continues to advance. So mutations that we could not identify years ago are now being identified. So making a negative in 2007 a positive result now in things that we were already tested for. So I think it makes sense to revisit. If you have a question of when your testing was done or what you were tested for, reach out to the genetics program where you had your genetic testing, and your genetic counselor will be able to tell you you were only tested for BRCA1 and BRCA2. But again, there's new data, new mutations, so you should probably update your testing. So I think it's best to go back to the source and ask them, when was my testing and does it need to be repeated? But I think for anyone who had testing prior to 2010, that's worth the question. If you've had testing in the last couple of years, probably 2018 moving forward, you've probably had pretty significant testing, meaning that you've been tested for the most up-to-date panels, you've been tested with the most up-to-date technology. So, you know, I think it's still a conversation you can have, but those I would feel more comfortable with, sort of saying you don't need to be retested. So I think it's reasonable to ask your genetic counselor every maybe 3 to 5 years, is this something that I should revisit as technology ramps up and as we just identify more genes, more mutations. The other route that people come in with is testing that's been done at a direct-to-consumer place. So something like 23andMe or wherever else they're doing it. So I think those tests always should be repeated by a clinical lab. So you should always bring the result from a direct-to-consumer test, whether it's positive or negative, to a genetics professional. And the reason is that some of these tests are very limited in what they're testing for, but the fine print is hard to find on the report. So even if you think you're BRCA negative because you took a 23andMe test, I would still make sure that you discuss that result with someone, because it may not be applicable to you because you may have had just incomplete testing. The other problem is that there can be false positives, so that test says you have a BRCA1 mutation when in fact it's not a true mutation, and a lab that's trained to do genetic testing would call it something different, and it probably wouldn't be as impressive. So I think any report done at any time by a direct-to-consumer test should be repeated or at least discussed with a genetics professional. And again, if you've had testing by a genetic counselor at a clinical lab, if it's been 3 to 5 years, it makes sense to revisit testing or at least have the conversation of whether you need to. So we get the question from a lot of patients that said, you know, I've had a positive result. I've known about it for a few years now. I've already seen someone. Does it make sense to come back and see a genetic counselor? And I always say the answer is yes. And the reason is that we know that things change over time. So data changes, evidence changes, research studies open and close. So I think even I say to my BRCA carriers, even if you've had preventative surgeries, you've had a mastectomy, you've had an oophorectomy, and you sort of think you're done, I think there's still the need to revisit, is there anything new in terms of, for example, pancreatic cancer screening? Is there anything new, you know, for other cancers? Is there new evidence to suggest I should be doing something differently? So I always think, you know, a reasonable time frame every 2 to 3 years to check in with your genetic counselor. Just make sure that nothing's new, nothing's different, and that you're not missing anything. We do try to keep up with it, but it's harder on our end to retrace our steps and update everyone, whereas you can easily call, you know, where you had your testing done and ask them if there's anything new and if you need to see them. The other reason is for people who, you know, they had young children who were not eligible for testing at the time because they were too small. Now it's 10 years later and my child is of age, or, you know, getting to the age where I would consider testing them. How do I go about that? This was a long time ago. Your kids may have been little and they didn't know know this was going on. So I think that's always worth a conversation. When should I test my kids? How should I test my kids? And what's the new information? So I think that the familial testing is always a reason to revisit, especially if your family members weren't ready or weren't, appropriate for testing at the time that you had your own testing. The genetic counselor can walk through all of that with you and hopefully answer any new questions.